Greetings. Let us talk about portal vein thrombosis and let us review what causes portal vein thrombosis. Before we go there, I want to thank many who support this venture and also want to let this notice out there. So here is a portal vein anatomy. So splenic vein from the spleen and superior mesenteric vein join together to form the portal vein, and the blood goes to the liver. Portal vein thrombosis can start in the portal vein and may stay there or may extend into its tributaries, either superior mesenteric vein or into the splenic vein. So to understand portal vein thrombosis, we should first understand what are the three components as described by the great physician, Dr. Virchow, known as Virchow's triad. And the three components are the blood vessel, the flow inside the blood vessel, and the contents of the blood vessel. When all of these are working well, you'll have a clean flow through any blood vessel, whether it is artery or a vein. And when there is a change in any one of these parameters, either in the vessel or in the flow characteristics or the contents of the blood, the cells or the protein constitution of the blood, it can result in a clot. So let us review this. So first, let us talk about the blood vessel, and if it is damaged and results in endothelial damage, it releases tissue factors that result in thrombosis of the blood. So, what all can cause a vessel damage inside the abdomen? It could be due to inflammation of any of the organs inside the abdomen. So, to just take you through, if the colon is inflamed, either because of colitis, ulcerative colitis, or Crohn's, it can result in inflammation of the blood vessels as well and can result in thrombosis of the vessels. You could have pancreas inflammation, again, splenic vein thrombosis. If you have diverticulitis, you can have inflammation of the inferior mesenteric vein and thrombosis. If you have cholecystitis, then gallbladder is close to the portal vein, you can have portal vein thrombosis. So inflammation anywhere inside the abdomen can precipitate thrombosis by damaging the blood vessel, endothelial damage, release of tissue factors, and initiate the clotting cascade. Another important factor is injury. Injury could be trauma from outside, or injury could be surgical injury. So, any type of surgery inside the abdomen can result in thrombosis of the splanchnic vessels. It could be after a colectomy or after pancreatectomy, after gastric surgery, or after gallbladder surgery. Any surgeries or any type of injuries, whether it's surgical or blunt trauma could also damage the blood vessel, release tissue factors, and start the clotting cascade. So we looked at the vessel and vessel damage resulting in thrombosis. In this case, portal or mesenteric or splenic vein thrombosis. On the other hand, if the vessel is in good shape, but the flow is slow to the point of causing thrombosis. And a typical example of a slow flow or stasis is when there is resistance to the flow of blood through the portal venous system inside the liver or from the liver to the heart. So classic examples are in the liver, cirrhosis, and in the heart failure. So now we talked about the blood vessel, we talked about disturbances in the flow. And let us come to what is flowing inside the blood vessel. So the blood consists of red cells, white cells, platelets, and the plasma consists of various factors that are either procoagulants or anticoagulants. If there is increased procoagulant effect or decreased anticoagulant effect, again you can end up with thrombosis. So let us look at if the cell content or the protein content increases, it will end up with thrombosis. So when you look at cells, you should always think about myeloproliferative diseases or myeloproliferative neoplasms. Classic example is polycythemia rubra vera or thrombocythemia, and sometimes other myeloproliferative diseases can also result in thrombosis. If there is a disturbance in the coagulation cascade, we know bleeding disorders can happen, but if there is a disturbance in the coagulation cascade, more active procoagulants like factor V Leiden or prothrombin gene changes push the cascade forwards, resulting in thrombosis. There is a natural anticoagulant mechanism that is mediated by protein C, protein S, and antithrombin. If they're deficient, then you cannot stop coagulation from happening. You can also see thrombosis. Cancers can create clotting disorders. Typical example is pancreatic cancer. And another example is hepatocellular cancer. Finally, you should always think about contraceptive pills and pregnancy, which increase the risk of thrombosis. And lastly, paroxysmal nocturnal hemoglobinuria should also be kept in mind. So let me summarize. When you see thrombosis of a vein, in this case portal vein or a mesenteric vein or a splenic vein, think about the vessel, flow, and the contents of the vessel. Disturbances in any of these three mechanisms can precipitate a thrombus. So vessel, think about inflammation. So does the patient have any signs of inflammation like diverticulitis, pancreatitis, cholecystitis, appendicitis? Any one of those, you should think, hey, this may be responsible for the thrombosis. Or If there is a blunt injury or patient is in the post-op period after major abdominal surgery, either on the stomach, pancreas, colon, intestines, gallbladder. So they all cause damage to the vessel and precipitate thrombosis. Then you think about contents of the vessel. If either cells are increased in number, like polycythemia, thrombocythemia, or if there is an imbalance between the procoagulants and anticoagulants, factor V Leiden deficiency, factor V, factor V Leiden issues, prothrombin related issues, or deficiencies of anticoagulants like protein C, protein S, antithrombin. And lastly, is the flow slow, like in a patient with cirrhosis or patient with heart failure? So when you have portal vein thrombosis in a patient with cirrhosis, you can automatically assume it is a slow flow status that resulted in thrombosis. On the other hand, if you don't have cirrhosis, then you have to be looking for, is there inflammation, is there trauma, or is there thrombophilia? And try to investigate those issues before you assume there's no definite precipitating factor. I hope this is helpful. Thank you.